Welcome back. You're watching Prime Edition. Let's go back to our top story tonight. And President William Ruto has directed the Ministry of Health and the Social Health Authority, SHA, to review gaps in the current health insurance benefit package following concerns raised by patients over the costs of treatment. Speaking during the Kenya Health Summit at the Kenyatta International Convention Centre, KICC, in Nairobi, the president said the government is keen on working on the shortcomings highlighted by Kenyans during their interaction with the insurance fund. In the directive, Ruto said the review must be based on the actual cost and the government's ability to sustain any new commitments.
The president was responding to concerns raised by patients with kidney disease who called for expanded coverage for acute kidney injury and greater access to kidney transplants. Concerns raised during a session in which President William Ruto directly engaged patients on challenges they continue to face under the new health insurance system.
We are working on a benefits package for SHA. We had an initial one because we also wanted to be sure that we don't say we are going to pay for so much and yet we had not had an experience of whether we would be able to pay or not. With the benefit of a year and a half of working with the benefit package that was there, we are now ready for a review on areas that citizens like you, Wanjiru, has come back to us and say, there is this pain point on my visit for cancer treatment.
The president directed health officials to assess the financial implications of expanding the package before making a commitment. He also called for better data on kidney disease to guide government decisions on treatment and prevention.
It is possible for us, and it is necessary. The reasoning given by Mr. Gikonyo there is to be able to effectively provide interventions, we must have a good body of data. Numbers are important.
The cost of cancer treatment and access to specialized services also featured in the summit. The president said the government is using its purchasing power to negotiate lower prices for medicines, citing an agreement that reduced the cost of one cancer drug from 135,000 shillings to 40,000 shillings.
I met the president of Pfizer once. I'm doing another appointment with him because quite a substantial part of the medicine that we are using comes from Pfizer. And our engagement with Pfizer now is that they will not be supplying our facilities individually. They will be supplying us collectively. And that is the point why Duale is saying we are going to engage them this time round so that we can negotiate the prices the same way we negotiated the prices for Roche and all the others.
Ruto also said the government is engaging pharmaceutical companies to secure lower prices for essential medicines, while urging health officials to address complaints from patients who are still paying out of pocket for services they expect SHA to cover.
We should, therefore, with the assistance of DHA, be able to work with citizens if they go to a facility and in the facility they are told either this equipment is not there, go to the next, or this medicine is not here, go to the next. They should be able to verify, you know. This is homework for us. This is feedback for Mercy and for Anthony and the PS and Minister for us to go and figure it out and work with the counties to make sure we get rid of that mischief.
The president said the feedback from patients will inform the ongoing review of the SHA benefit package, with health officials expected to present proposals by the end of October.
We're still collecting data on making sure that when we do an assessment of a citizen on how much they pay, we must be as near accurate as possible. so that we do not burden a citizen who has a certain ability and we misjudge them to have a different ability. So that is good feedback, but already it is in our radar that we have a means testing instrument. We are still gathering data, and we are we're trying to access data from different sources so that we can have a much more accurate means testing instrument.
The discussions come as the government seeks to assess the first phase of SHA implementation and address gaps in access, affordability and coverage of specialized medical care. Ben Chumba, Prime Edition.